This is Dr. Vaishali, and I'm reading from the book Substance of Homeopathy, book written by Dr. Rajan Sankaran, the chapter number 1, Introduction. As a student of homeopathy, we found the whole system quite confusing. We could see no system, no order. There were many school of thoughts and practices. Many rules, dogmas, and habits took over where there was a lack of understanding of the principle of the materia medica. Our results were consistently poor, yet the occasional brilliant cure convinced me that there was some explanation to such a success which, once understood, would allow us to repeat the process with similar result. Studying these successful cases, I tried to understand the main idea behind homeopathy. This took me a fascinating journey leading to new understanding of the health, disease, and the cure. And this formed the basis of a previous book, The Spirit of Homeopathy. In it, I have explained the concept of disease as a delusion and how this idea can be applied in practice to heal. The book has become quite popular, and many colleagues have reported that they found the idea very useful in practice. This was only the first step. However, many things had yet to be explained. For the same patient, different homeopaths are prescribed entirely different remedies. I had thought initially that this was due to the difference in case taking. But even the seminar where I took case in the front of the audience and all could observe the same, there were at least 20 different suggestions for the same case, which meant to me that we were still prescribing on the symptom. It would take some symptoms or some ideas and come up with some remedy. There had to be a way, I felt, whereby all could arrive at a small group of closely related remedies, if not the same one. There was a need for a map to chart our way in this ocean of the drug and disease. My effort in the past 2 years have been in the direction. I had already developed my concept of disease as a delusion, and now wonder if disease states could be classified. I somehow saw such a possibility through Hahnemann's idea of miasm. The idea of miasm, which I had discarded earlier as unimportant for practice, suddenly it struck me and as a most useful tool to the classified disease state. I interpret this miasm using my understanding of disease as delusion, and the result I find it classification of the most practical utility. Miasm now represent to me the different possible type of reaction, which naturally means different type of perception of the reality. One type perceive reality as an acute threat and react instinctively and suddenly in the impulsive manner. This is the acute miasm. As I have termed it in Sora, reality is seen as a problem that can be solved by a struggle, and while in psychosis the problem seems insoluble, and a reaction is attempt to cover up this inability to cope, and the syphilitic perceive the situation as hopeless, desperate one, and become a destructive as a result. I found that this state could be beautifully worked out on this framework, and the patient understood better. It became easier to arrive at the remedy to make the process more accurate. More points were required on this map. I worked on other miasm in between the main miasm and discovered the subacute, ringworm, malaria, leprous, and the cancer miasm. This, together with the tubercular miasm, provide a valuable map to study the disease. To verify the truth of my hypothesis, I undertook a prepare and prove the ringworm source, and also did a proving of a bacillarium. The proving further substantiated what I already found in practice, that the idea of miasm was valid and most useful. The concept of miasm not only helped deepen my understanding of disease process, but also gave me insight into other phenomena in the world around, as for example, the reason for the increase in the new diseases. I am very happy with this discovery. But this was not still enough. The substance that make up the homeopathic materia medica had to be understood deeply and if possible, classify and map out, just as we have mapped a disease state. I got my first hint while preparing a lecture on Argentium metallicum. I noticed that the symptom of this remedy revealed the quality of performance and show. For example, trouble of speakers, singers, and preachers, etc., which I could really relate to the silver itself. Silver means silver tongue. Silver is for show. Similarly, aurum metallicum means a gold also has a strong theme of performance, but with a responsibility, industriousness, and conscientiousness. I wondered if this theme was common to all metals. After studying the metals one by one, I was convinced that all the metals have in common the theme of performance and defense, which is everyday life too. Is their function? This drew my attention to the periodic table, which I studied with a keen interest, and I found that as the metal got heavier and heavier, means atomic weight increase, that performance increased in the degree. Moreover, closely related remedies were placed in the same group of the table. For example, palladium and platinum, two well-known complements in homeopathy, are placed in the same group. Platinum, the heavier one, just below the palladium. I then started studying other elements in the periodic table and found a common theme of the cation, another for the anion, and then for the salt and the acid. There were some elements that could not be understood in their essence from the available proving record. This I decided to prove myself with some student and colleague. I conducted a proving of ferrum metallicum and later of iodum. This proving deepened my understanding, and these remedies are also of the periodic table in general. I studied the well-known idea of using remedy by studying their component part. For example, magnesium and sulfur in magnesium sulfuricum, and developed it further. I found that the component of salt do not just coexist, but there is an interaction between the component ion and the understanding of ion, and their interaction enable us to deduce the possible state of the drug. This is useful even with the old frequent used drug, but especially so with the lesser known and poorly proven one. I put this idea straightway to the test in practice with the most gratified result. At this point, I met Rajan Sankaran and from the Holland, who had been walking along similar themes. His work confirmed and added to my findings. After studying the minerals, I turned my attention to the animal kingdom. With my friend Rajan Baker, I had a seminar in Bombay where we proved Naja, the Indian cobra. This proving encouraged us to study snake in general, and we started using other snake remedies like Crotalus cascavilla, Crotalus horridus, Vepra, and Elaps corallinus, based on the appreciation of the quality of the snake with a finer differentiation to decide which one is the particular. Having found a theme common to snake remedy, I went further and tried to discover if there was a common theme in the entire animal kingdom. There had to be for animal have distinguishing quality. Thus, I came to my simplest and most important discovery, like the difference between the remedies and the belonging to different kingdom and plant, animal, mineral, no source, etc. This discovery was built gradually from the observation of several hundred patients and confirmation in severe and several disease on several other confirmation in several other way. This observation of natural phenomena have formed in a beautiful map of remedies, which, if we understood and correctly used, make our tasks so much simpler. The study, however, revealed more clearly than ever the deficiency in materia medica. There are few well-proved animal remedy. Many of the element in the periodic table remain to be proved. It is heartening to find that colleagues like Jeremy Scher are actively taking up this task. I have found my own knowledge of botany rather poor and hence could not easily link the plant source to the remedy proving. I wish to understand the detailed study of this shortly, but have for now given in the section on plants some general directions toward the vast kingdom. There is so much to learn still, and ignorance is no bliss. It allows the mind to rest. In a seminar in California, I decided to prove the cannabis indica in the potency with my colleagues. The proving was most rewarded, and not only did we learn much about cannabis but also made a startling observation. The most characteristic symptom of the drug was produced in a woman who was the participant who had not taken the proving dose. She developed a symptom that she had never experienced before in her life, and this coincided. This coincidence with those who had taken the dose. A similar phenomenon was observed again at the Spikon in a Germany seminar where bacillum was proven. The best proving were from those who had not taken the dose. This is enough to see the mind thinking of the long time, thinking for the long time. The spirit of homeopathy. I talk about homeopsychotherapy. Example, presenting the image back to the patient instead of giving the remedy in order to bring about the awareness in the health. I have now chosen another medium, one close to my heart. That is music. Music can affect the state of mind and produce a mood. Why then can it not be used curatively on the homeopathic principle? This thought result in the music proving, and where we prove our four tune, means Indian raga, on large audience at the different places, and the results were remarkable. And I think that this proved raga can be used effectively on the homeopathic principle as a music remedy. I have found some aspect of the homeopathic philosophy rather puzzling, and the solution I felt had to be of great significance. For instance, when does a state crystallize into organic tissue changes? For significance, when does the state of the crystallize into the organic tissue changes? An interesting observation made in a case provided the clue to the answer. I believe my idea in the state and pathology will be immense value in the practice. These theories and experiment ideas and experience have all helped me to grow as they develop, though I realize that this is but not a step forward in a long journey. Even a little rays of light is most encouraging to mind in a darkness and gives impulse to go further. I wanted to share all this experience with my colleague at this stage, and hence this book. I would like the reader to be with me at every step, and therefore urge him or her to read first the spirit of homeopathy first, and then after which this book will be much easier to understand and follow. Finally, while study of symptom form the bedrock of our practice, the idea in this book will help expand the possible application of the law of similar. It affords a new view of the world where homeopathy is brought closer to other branches like chemistry, botany, zoology, and music. As we take each branch of the knowledge and move inward close to the stem, we are able to relate to the other branches. Once at the very stem, the difference between the branches disappear. We have reached a point of origin of the various branches, and we are now free to take any of them. I hope this book initiate your movement towards the stream of knowledge, just as the idea in it have done for me.